Can the immune system really recognize and destroy cancer?
Yes, because these cancer cells, like I said, express certain proteins called PD1, PDL1, and they prevent the body's immune system from attacking it.
How many patients are able to afford immunotherapy in the current?
Immunotherapy, even within the reach of the common man,
Why are some stage 4 cancer patients living longer today?
that is the remarkable success of immunotherapy.
Hello everyone, I'm Ashwarya and today we're here to discuss about one of the most exciting advancements in modern cancer treatment, immunotherapy. And to do this, we have with us Dr. Nitin Yashas, Consultant Medical Oncologist, Hemato-Oncologist, Manipal Hospitals. Welcome, sir. So what is immunotherapy and why is everyone suddenly talking about it?
So basically, immunotherapy is activating the body's own immune system to fight the cancer. For many years, there were not really dramatic advances in cancer treatment, but when immunotherapy came along, it even won the Nobel Prize.
Okay.
So the biggest advantage of immunotherapy is that we started seeing patients in stage 4 cancer live longer, where we started talking of survival being in terms of years. And there was a section of patients where when we did a PET scan, we would not see any disease. And the most important part is these responses continued even after treatment was stopped, which is why immunotherapy has been one of the most dramatic breakthroughs in cancer.
So if you were to differentiate between immunotherapy and chemotherapy, what are the main differences?
Yeah, so chemotherapy, you can always say, is an external agent which is killing cells.
Okay.
It kills good cells and it kills the bad cells, which are the cancer cells. Immunotherapy is not like that.
Okay.
Immunotherapy are IV medicines which are unblocking our body's immune system to fight the cancer cells. Now, one of the reason cancer happens is that these abnormal cells are escaping detection by our immune system due to various proteins that they are expressing, most commonly what we call as the PD1, PDL1 proteins. So it is preventing our immune system from attacking the cancer cells. But by giving immunotherapy, we are removing this block. That is why they are called as checkpoint inhibitors, so that our immune system can attack the cancer cells.
Okay, interesting. Can the immune system really recognize and destroy cancer?
Yes.
Okay.
So because these cancer cells, like I said, express certain proteins called PD1, PDL1, and they prevent the body's immune system from attacking it.
Okay.
So when you're removing that block, the body is doing what it is best at, which is recognizing these abnormal cells and killing it.
Okay, got it. Why are some stage 4 cancer patients living longer today?
That is the remarkable success of immunotherapy, because when immunotherapy induces a response in cancer patients, there can be dramatic responses.
Okay.
So I remember still about almost 6-7 years back when we started using immunotherapy in stage 4 kidney cancers. We started even when seeing that patients where the cancer from the kidney had spread to the bone, lungs, liver and other organs, it used to disappear after 3 to 4 months of treatment. And what we started seeing is that these patients continued to stay in remission even after treatment was stopped, where year after year we started doing PET scans and we were not seeing any evidence of the disease, which is why we say there are some patients who respond very well to immunotherapy. Now, there are some markers which we use to possibly guess or decide as to which patients would respond better than others. So one is, of course, looking at the PDL1 expression on the tumor tissue. There are some patients where they have a deficiency in what is called as the mismatch repair proteins.
Okay.
They are called as MMR deficient tumors. They have dramatic responses to immunotherapy. So we call these markers as biomarkers which predict a better response to immunotherapy.
Understood. Why do some patients experience extraordinary responses?
So this is the reason.
Okay.
That they may have certain markers which are potentially predictive of very good response to immunotherapy. More than PDL1, MMR is a marker.
Okay.
So now when we say is, previously immunotherapy had indications organ-wise or tumor-wise. Now we say irrespective of the tumor, if a tumor is MMR deficient, then immunotherapy becomes one of the mainstay of treatment in stage 4 malignancies.
Okay. Is immunotherapy safer than chemotherapy?
Yes, that's a very important point. Chemotherapy, we all know, is associated with a lot of stigma. It induces fear,
Yes.
sometimes as much as the word cancer.
Yes.
Chemotherapy is associated with hair fall, nausea, vomiting sometimes. The WBC counts can fluctuate. There's a risk of infection. Of course, supportive care has improved for chemotherapy. There are newer generation anti-vomiting. But the thing about immunotherapy is age is not a barrier to give immunotherapy.
Okay.
We have given immunotherapy even in patients older than 80 years.
Oh, wow.
They do not have the traditional side effects of chemotherapy. They sometimes can have very rare side effects where the body's immune system can become overactive.
Okay.
But most of the times they are manageable. The common ones that we have seen are some fluctuations in the thyroid level, skin rash, diarrhea, but rarely it can cause inflammation of any organ. But because it is not associated with the traditional side effects of chemotherapy, and that comes down to its mechanism of action, because it is not killing the normal cells.
True.
That is why immunotherapy is much safer than chemotherapy.
Which cancers are benefiting most from immunotherapy today?
6-7 years back, we could count it on our fingers. Now, almost every organ and every tumor has a indication for immunotherapy. You look at lung cancer, you look at kidney cancer, head and neck cancer, stomach cancer. Like I said, those tumors which are MMR deficient, certain types of uterine cancer, skin cancers, you name it, immunotherapy is an indication. And the more important thing is, immunotherapy used to be used only in stage 4 cancers.
Okay.
But now we have started using it in earlier stage to cure patients.
Oh, wow.
So in a sort of triple negative breast cancer, we are using immunotherapy with chemotherapy.
Okay.
Stomach cancer, we are using immunotherapy with chemotherapy. Liver cancers, kidney cancers, where chemotherapy actually does not work well, we are combining immunotherapy plus targeted therapy. So gone are the days where we are using immunotherapy as a single agent. We are combining either with chemotherapy or targeted therapy, or sometimes we are using double immunotherapy as well. Sometimes even in earlier stage diseases, like I said, to try to get cure as such. So the indications of immunotherapy have really expanded.
So when you say double immunotherapy, can you throw more light on that?
Yeah, so like I said, most immunotherapies right now act against the PD-1 or the PD-L1, but these are some of the few checkpoints.
Okay.
There are other checkpoints as well, what we call as CTLA4. So you're trying to use immunotherapies which are acting against different parts of the immune system to unblock them, to activate them, and you're trying to harness the combination or the synergy as such to get better responses. Typically, more or less, this is being used in lung cancer, kidney cancers, liver cancers, but like I said, gone are the days when we are looking at single agent immunotherapy. It's either immuno with chemo, immuno with targeted therapy, or dual immuno, which we call as IO therapy, to produce better responses.
Got it, sir. How many patients are able to afford immunotherapy in the current day?
That is a very good question, because one can never ever sort of push away the question of cost and the practicalities. 6 years back it used to be difficult, though there used to be support programs. It used to be out of reach for a majority. There used to be issues with insurance, but over time cost has improved, support programs have improved, the insurance access has improved, but more importantly what we are seeing is the surge of the biosimilars. So with the entry of biosimilars into the market, which with research and with papers showing good efficacy, going through the established regulatory pathway, biosimilars are establishing immunotherapy even within the reach of the common man. We also have some interesting research papers from India, from centers, where they have also looked at the concept of low dose immunotherapy in certain cancers. But I think with the era of biosimilars coming in and improved patient access programs and patient support programs, we are seeing definitely it reach most of the common man to access it.
Okay. So is there any final message that you want to give to our viewers?
So I would always say that cancer is something that should not be feared. One should not ignore or neglect any symptoms thinking that it does not have chances of cure. We always talk about early detection, screening methods, and we always talk about leading a healthy lifestyle, because cancer is also a lifestyle disease, and with immunotherapy, targeted therapy, and wonderful chemotherapy regimens with good supportive care. When detected early, we are talking of high chances of cure in many malignancies, and even in stage 4, no one should lose hope and should be afraid of starting treatment, because with the newer medicines, we can prolong survival with good quality of life.
I think one must stop associating cancer with death, right? I mean,
Absolutely, and we always say that diabetes and hypertension cannot be cured, but cancer in early stages can always be cured.
thank you so much, Doctor, for sharing such valuable insights. I think conversations like these are truly important to create awareness that can help save lives. Thanks again.
Right. Thank you so much.